Hello everyone, welcome to Planet Ayurveda channel, and today we will be going to discuss about Srotas Shari, which means the study of body channels. Why this topic is important? This topic is important to study because the pathy of Ayurveda is totally dependent upon this. The disease occurs due to vitiation of these body channels only. So that's why our today's topic of discussion is really very important for those who are practicing Ayurveda or even studying Ayurveda. So let's start with our today's lecture. So what are Srotas? Srotas are the channels or systems in which some tissue is forming, some tissue is metabolized, then it is transported, or whether it is secreted. So the body channels are some pathways, you can say, some pipelines through which whether the waste is flowing, whether the energy is flowing, whether the emotions are flowing. So these channels are responsible for transporting everything inside our body, whether it's food, whether it's waste, whether it's emotion, whether it's energy. They also metabolize things, they also secrete things, and they also transport them. So the body channels are the things that, or the pipelines that helps in formation of something, metabolization of something, secretion and transportation of something, whether they are related to anything: body waste, body nutrients, body energies, and body emotions. So this was about the introduction of body channels or the Srotas. Now we will discuss about the classification of Srotas or the body channels. So basically, first of all, they are categorized into two categories. The number one category is Sukshma and Sthul, which means on the basis of minute channels or the gross channels. If you can see over the screen, here it is mentioned that the minute channels are innumerable in number, which means we can't even count them. But if we talk about the Sthul one or the gross, they are countable one, and they are further categorized into two. Bahirmukh, which means those channels which have the external opening, and Antarmukh, which means those channels which have internal openings. Again, they are further categorized. The Bahirmukh, although everybody knows about that, even though layman people also knows about that, whosoever even don't have any medical background, they also knows about these external orifices. We will just discuss about the names of these external orifices in the next slide. And in this session, we will discuss, or we will more focus over the Antarmukh or the internal channels. So before moving towards the Antarmukh or the internal channels, let us look into the names of the Bahirmukh or the external orifices. So as you are able to see over the screens, usually they are 9 in numbers in males and 12 in numbers in females. What is the difference? Let's have a look. So in males and females both, there are 9 orifices which are present in both males and females. The anus, 2 ear opening, 2 eye opening, 2 nasal openings, then 1 urethral opening, or from where we pass the urine, okay, and 1 mouth. So these 9 orifices are present both in males and females. But in females, there are extra 3 orifices: 2 breast opening and 1 vaginal opening. So that's it about the external orifices. Our main topic of discussion is internal orifices or the Antarmukh body channels. So let's talk about them. So first of all, let's look into their names, for what those channels are responsible. First of all, here it is mentioned about the Pranavaha Srotasa. Pranavaha Srotasa are the channels, are the body channels that are responsible for the respiration, that plays important role, or those channels that work for the respiration. Okay. Then is Udakvaha Srotasa. Udakvaha Srotasa are the channels of fluid distribution. So they distribute fluid over all the body. Then is Annavaha Srotasa. Annavaha Srotasa are the channels of alimentary canal, as it is mentioned. These channels are responsible for food intake, food metabolization, food transportation, everything. So next is Rasvaha Srotasa. These are the channels of lymphatic system. So these channels are closely related to the lymph or plasma also. Then is Raktavaha Srotasa. Raktavaha Srotasa are the channels of vascular system. So whatever is related to the blood cells, to the blood, is the channels of vascular system or the Raktavaha Srotasa. Then is Mamsvaha Srotasa. These are the channels which provide nourishment or nutrition to the muscle tissue. Then is Medovaha Srotasa. Medovaha Srotasa are the nutritive channels of fat tissue or the adipose tissue. Then is Asthivaha Srotasa. Asthivaha Srotasa are the channels of bone nutrition or bony tissue, you can say. Then is Majjavaha Srotasa. Majjavaha Srotasa are the nutritive channel for bone marrow. Then is Shukravaha Srotasa. So these channels are the nutritive channel for reproductive tissue. Mainly these channels are representative to the male reproductive tissue. Then comes the Mutravaha Srotasa. Mutravaha Srotasa are the channels of urine formation, urine transportation, urine excretion. Okay, they are related to the urine. Then is Swedvaha Srotasa. Swedvaha Srotasa are the channels of sweat. They are the channels that are responsible for the formation of sweat and for the excretion of sweat. Okay. Then is Purishvaha Srotasa. Purish means stools, fecal matter. So these are the channels of transporting fecal matter. Okay. Then here it is not mentioned, but one more Srotasa about which we will learn, even though two more Srotasa. One Srotasa is Artavaha Srotasa. So Artavaha Srotasa are the channels of menstrual blood. And the last one about which we will talk, and even though in Ayurveda text it is not mentioned about those Srotasa or those body channels in detail, but they are really very important because those Srotasa are related to our emotions, our sadness, our happiness, stress. So everything, every emotion, with the every emotion those Srotasa are related. And even though a lot of diseases, for a lot of diseases, those Srotasa are responsible. So those Srotasa are related to mind. Their name is Manovaha Srotasa. Okay, so these are the 15 Srotasa, 15 internal body channels about which we will be going to study. Before studying about them in detail, let us talk about their roots, the mool of Srotasa, roots of body channels, from which they specifically originate, even the site or the organ, basically from which their functioning originate. Okay, from which the functioning of those channels is controlled, you can say. So mool or root of Srotasa is the anatomical seat of the respective Srotasa. So let's see from where each of the body channel is originating, or from where they are getting command to work. So first one is Pranavaha Srotasa. So their site or originating function site or organ is heart and GI tract, or you can say Mahasrotasa. Then comes the Udakvaha Srotasa. They basically originate from our oropharynx and the palate, talu and clone. Then next one is Annavaha Srotasa. Annavaha Srotasa mool is, or the root is, Amashya, which means stomach, and Vampashya, which means left-sided flank or left flank. Then comes the Rasvaha Srotasa. Their mool is heart and its 10 vessels. So they basically originate from heart and its 10 vessels. Then is Raktavaha Srotasa. Their mool is liver, which means Yakrit, and Pliha, spleen. Then comes Mamsvaha Srotasa. Mamsvaha Srotasa mool is Sanayu or Twacha, which means ligament and skin. They originate from ligaments and skin. Then next one is Medvaha Srotasa. Medvaha Srotasa originate from kidneys, that means Vrik, and Vapavah, which means omentum. Then comes the Asthivaha Srotasa. Asthivaha Srotasa originate from Jhagana, which means the hip region, and the adipose tissue, which means the meth. Then comes the Majjavaha Srotasa. Majjavaha Srotasa originate from bones and joints. Okay. Then comes the Shukravaha Srotasa. Shukravaha Srotasa originate from Vrishna and Shef, which means testes and penis. Then comes the Mutravaha Srotasa. They originate from the Basti, which means urinary bladder, and the groin region. Then comes the Swedvaha Srotasa. Swedvaha Srotasa originate from meth, which means adipose tissue, as well as lomkupa, which means hair follicles. Then comes the Purishvaha Srotasa. Purishvaha Srotasa originate from Guda, which means rectum, as well as the Pakwashya, which means the large intestine. Then comes the Artavaha Srotasa. So Artavaha Srotasa mool is, or the root is, Garbhashya, which means uterus, and menstrual blood carrying arteries. Last one that we have talked is Manovaha Srotasa. So their root is again heart and its 10 vessels, same as that of the Rasvaha Srotasa. They also originate from the heart and the 10 vessels. So till here we have discussed about the mool of Srotasa, or the roots of body channels. Now we will talk about the types of Srotodushti. So various type of Dushti or vitiation, how these body channels get vitiated and leads to cause various diseases. So let's talk about those Dushtis or those vitiations. So basically these vitiations are of 4 types, in which number 1 is Ati Pravriti, which means excessive flow of anything. Then is Sang, which means obstruction. Then is Vimargagaman, which means the contents of that particular body channel flow to the other side, which means Vimargaman. Okay. And the last one is Sira Granthi, which means the abnormal growth in the body channel. So these are the 4 causes due to which the disease is causing. Okay. So here the example of each is given. Let us see. So for the Ati Pravriti, the example is given hyperacidity or amlapit. So hyperacidity means increase of acid. So acid form inside the stomach. If it increases from its normal amount, it leads to more production of it. So Ati Pravriti, hyperacidity caused by that. And diarrhea. Normally, a person goes to stool for passing stool for 1 to 2 times a day, and the motion is solid in form. It is said that same like that of banana. In Ayurveda, it is said that normal motion or normal stool is same like that of banana. But in case of diarrhea, what is happening? The Ati Pravriti of Purishvaha Srotasa is occurring. Purishvaha Srotasa are the Srotasa or the channels that carries fecal matter. So their Ati Pravriti is happening, which means person is going for 4 to 5 times a day or 6 to 7 times a day, and the loose stool is coming, okay, or unformed stool is coming. So these are the examples of Ati Pravriti. Then next one is Sang or the obstruction. For that 2 examples are given, constipation and sweating. So constipation, again it is also the example of obstruction of the channels carrying fecal matter, channels eliminating fecal matter, or the Purishvaha Srotasa. So when there will be blockage in the large intestine or in the rectum, those are the roots from which Purishvaha Srotasa originate. So if there will be blockage in those channels, then what will be going to happen? The stool will not come out. The person will not be able to excrete the stool. So that's why it leads to constipation. Then is no sweating. So what will gonna happen if there will be obstruction in the Swedvaha Srotasa, or the channels that produce or excrete sweat? If there will be obstruction in those channels, it will lead to obstruction of sweat, no sweating. Then third one is Sira Granthi. So Sira Granthi is simply overgrowth in the body channels. So it will lead to tumor, it will lead to benign growths, even cancer also you can say, or even the cyst. Next one is Vimargagaman. So in Vimargaman, what happened? I already told you that Vimargaman is that vishation in which what happened? The flow content of one body channel goes to another side. So that is known as Vimargaman. For that, the example is given vomiting. So what happened? The food that used to simply, when we intake the food, what happened? It passes through the esophagus, then it goes to the stomach, then it goes to the small intestine, large intestine. They transformed into fecal matter, and then they get eliminated. Okay, but in case of Vimargaman, what is happening? The food that we have eaten, it is not going to the small intestine, then to the large intestine, and then not getting eliminated as a fecal matter. On the other hand, what is happening? It is coming out through the mouth in the form of vomiting. So this is one of the example of Vimargagamana. Or one more example I want to give you for the Vimargamana. It just struck to my mind. So even though when in case of heart disease, whenever there is the blockages in the arteries, what happens? The arteries not able to provide the blood to the heart, and heart not be able to pump it. Then what happened? The backflow happened, and in the backflow, what happened? It again caused the pressure over the pulmonary arteries. So when there will be the pressure on the pulmonary arteries, they get leaked out. The content get leaked out, and pleural effusion occur, which means that fluid fills in the pleural cavity and cause the pleural effusion. So that is also one of the example of Vimargagamana. So these are the types of Srotodushti, or the visheshan of body channels. How the disease occur after the visheshan of body channels. These four are the main causes of visheshan of body channels, and every disease is occurring inside our body due to these reasons only. Okay, so till here we have discussed about type of Srotodushti. Now we are moving toward the functions of Srotas, or the body channels. What are the functions? So hopefully it is clear to your mind also. Let's recall the transportation of anything. What comes in anything? Even the emotions, even the body waste, even the nutrition, even the energy. So to transport these things, so as if we take the example, the motions are forming inside the channels, the stools are forming inside the channels, the urine is forming inside the channels. So these channels also create something. These channels also eliminate something. So we are eliminating urine, we are eliminating fecal matter. Okay, so this is also one of the function of body channels. And transformation of something, changing one thing into other thing. So this is also one of the role of body channel. So these are the functions of body channels. Now we will be going to discuss about cause of vitiation of particular body channels, why and how those body channels are getting vitiated. We will look into particular causes, and we will look into their symptoms. We will look into what kind of diet we will follow for that, what kind of lifestyle changes we can do for that, and even though we will take a look into the Panchkarma therapies, the cleansing therapies, what kind of cleansing therapies we can do for that. So let's start with our first Srotasa, that is Pranavaha Srotasa, the channels of respiration. So let's start with the same. So first of all, let's take a look into causes of vitiation of Pranavaha Srotasa, or the channel of respiration. So first cause here it is mentioned is excessive physical activity. So even though, as you all know, it is mentioned in our Ayurveda text that Ardha Shakti Vyayam is allowed only, which means exercise is allowed only up to half of the particular person's strength. So if somebody will do excessive physical activity, it will definitely lead to vitiation of channel of respiration. The person will feel symptoms as it is mentioned, like dyspnea, increased respiration. Okay, so this is not allowed. Try to guide to your patients also. Then is natural urges suppression. So what are the natural urges that is related to the channel of respiration? Those are sneezing, coughing, yawning. So these are the natural urges that are related to channel of respiration. So that need to be avoided. What will happen when somebody suppress these natural urges? It creates a pressure over the channels of respiration, and at last they create the pressure over the lungs, due to which the lungs will going to get weakened, and further there will be deterioration in the respiration activity. Then is exercising while eating. This is also not allowed. The reason behind this is the content of other channel will goes into the another channel. Here comes the example for the Vimargaman. The flow of content reach to the other body channel. So what will gonna happen if we exercise and during that we are eating food? The food will goes into the windpipe, and a particular condition will occur, which is known as aspiration pneumonia. We will talk about the same in the next slide. Then there are few more causes. Let's say the exposure to direct wind or air for longer time, that will lead to vata visheshan. It will lead to increase in vata dosha. Then further it will lead to difficulty breathing. Okay, this is also one of the cause of visheshan of channel of respiration. Then second thing, if we intake heavy, oily and greasy food, this lead to kapha aggravation, and it further lead to accumulation of mucus in the channel of respiration, and further lead to various kind of diseases. Even though due to vata aggravation, asthma will occur. If there will be mucus accumulation, it will lead to blockages, it will lead to COPD like conditions. Okay, then comes one more thing that we make sure to ask to the patient of respiratory diseases, that they need to avoid intake of sour things. This will also increase the mucus. These are the few causes of visheshan of channel of respiration, and symptoms we have seen: the dyspnea, increased respiration, breathing with sound, so wheezing kind of sound will come. So that is due to accumulation of kapha or mucus inside the channel of respiration. The wheezing sound comes. It usually we able to see in the patients of asthma or COPD, when there will be the accumulation of mucus inside the channel of respiration. Such sound used to come. Then over the next page, it is mentioned about the type of Srotadoshti, visheshan of body channel, and due to that what kind of diseases are occurring. The examples for the same argument. So ati pravriti, excessive flow. For excessive flow, here are the examples: excessive sneezing, persistent cough, hyperventilation. So hyperventilation, what is hyperventilation? Hyperventilation is the condition in which person take fast breathing, deep breathing. And what will gonna happen in the same? Excessive CO2 will be eliminated from the body, and then further what will gonna happen? Levels of CO2 will drop down in the blood, and further it will lead to alkaline medium of blood, and due to that the proper blood flow or oxygen supply will not be going to go to the brain, heart and lungs. So this will lead to further visheshan of these organs, even the brain, even the heart. The person will experience palpitations, they may experience dyspnea, they may experience confusion, loss of concentration. So to the various symptoms related to heart, lungs and brain. So this is one of the very emergency condition, you can say. Then is Sangh or obstruction. Due to it what happened? Bronchial asthma, COPD, nasal congestion. So here comes the example of accumulation of kapha, where there is the cause kapha over there, When there is mucus in the channel of respiration, they will lead to obstruction and they will lead to further conditions such as bronchial asthma, COPD. COPD means chronic obstructive pulmonary disease, and nasal congestion. Then is Sira Granthi, or the abnormal growth. What kind of abnormal growth we are able to see in the Visheshan of Pranavaha Srotasa? So, tuberculous granulomas. What are these granulomas? These are the clusters of immune cells forming in the lungs. This is mainly due to the external pathogen, that is Mycobacterium tuberculi. This usually we able to see in the tuberculosis patients. Then comes nasal polyps. So there will be polyp formation inside the nasal cavities. Then is lung tumor. So these are the few examples of Sira Granthi, or the abnormal growths occurring in the channel of respiration. Then is Vimargamana, or the misrouted flow. So here comes the example of aspiration pneumonia, in which food enters into the windpipe. They further lead to infection and inflammation. So this is aspiration pneumonia. Pneumothorax. What happened in pneumothorax? In pneumothorax, the air leaks into the pleural cavity. That creates the pressure in the pleural cavity, and further the person leads to lung collapse. Then is air embolism. What is air embolism? It is a very dangerous condition. If air enters into the blood vessels, what will gonna happen? They will create a blockage, and even though pressure on particular organs, even venous embolism also form while IV injections. So they create blockages, and they further leads to damage to those particular channels in which they go. So these are the example of Vimargaman of channels of respiration. So now, what kind of diet one can follow who has Visheshan of channel of respiration? So particularly the diet usually depends on the dosha association. So where there will be vata, we need to give vata pacifying things. Where there will be kapha, we need to give kapha pacifying things. So accordingly, the diet need to be planned. But the common dietary things, common do's and don'ts, what a person with Visheshan of channel of respiration need to follow is like, they can take 1 spoonful of honey. The honey will clear the blockages from the channel of respiration. Eat warm and digestible meals. This will further also help out to reduce the kapha. Why we are specifically mentioning the kapha pacifying diet? Basically, the lungs, or the Pranavaha Srotasa, located in the upper chest region. So here, this part from the above of the abdominal cavity is the site of the kapha. So mostly we need to balance kapha dosha in case of Pranavaha Srotasa. The prominent dosha involvement in Visheshan of channel of respiration is kapha, so we need to prefer the kapha balancing diet. So then ask the person to drink warm soups and herbal teas. Now we can say them to take a soup by adding some black pepper into that. Also, cinnamon is very good. Cinnamon tea one can have. One can have a tea mixed with ginger, with cinnamon and with black pepper. That will also give really very good results in the same. Also, we can ask the person to intake the hot water in the early morning, or even though in the evening, by adding half teaspoon of turmeric powder into it. That will also be very, very beneficial. Then comes don'ts. What a person need to avoid. Whatever causes I have told, those causes need to be avoided. That is number one thing that we Ayurveda practitioners ask to the patient, that they need to avoid the Nidan Sevana. Means they need to avoid the causes of the particular disease. They need to cut off the causes of the particular disease. Half disease will cut off over there only. So we need to ask to them that avoid excessive exercising, avoid direct exposure to the air, avoid mucus creating diet like oily and greasy foods, avoid sweet or salty foods that increase the kapha dosha. Also ask them to avoid smoking. Smoking is also one of the major cause of vitiation of channel of respiration. So we need to ask them that avoid smoking. Also limit dairy products. Dairy products also leads to blockages, also leads to mucus creation. So we ask the patient to avoid dairy products also. Then is avoid heavy, oily and cold food items. Again, the kapha increasing diet. So these are the do's and don'ts that we particularly ask to the patient need to avoid. Then comes pranavaha srotasa, lifestyle changes. What kind of lifestyle changes a person can do? Moreover, this lecture is for the students, so please carefully listen to this. This will really help you out in your practice. The lifestyle changes we need to ask to them is do pranayam daily. Pranayam basically strengthen our lungs. So ask them to do pranayam. Anulom Vilom is one of the best pranayam one can do to cleanse their channel of respiration or providing strength through the lungs. Then is do sun salutation daily. Ask them to do Surya Namaskar. Steam inhalation can be done. Steam is also one of the effective way to clean the channel of respiration. So ask them to do the steam, even though you can ask them to add a little bit of ajwain into that water from which they are taking steam, even though you can ask to add black pepper or turmeric to that, and sendav lavan also. Then comes the panchkarma therapies. What kind of panchkarma therapies one can perform to clear the channel of respiration? So Vaman is indicated particularly in the vitiation of channel of respiration. Why? Because Vaman help out to eliminate the kapha dosha, which is the predominant dosha involved in the vitiation of channel of respiration. So Vamana, medicated emesis, will expel kapha and clears the lungs. Then comes Nasya, or the nasal administration of medicated things. So what will it going to do? Opens the nose, clears the sinuses, also remove the congestion from the nose. So Chhadbindu oil is usually and Anutel is usually really very effective in these kind of cases. Then comes Dhoompana, or medicated smoking. Even though cow's ghee administration can be done in case of Nasya. Then is Dhoompana, or medicated smoking. So after Nasya, Dhoompana is really very important to do because it clears the remaining kapha from the channels. Then it enhances the prana, which means the respiration, inspiration and expiration. So these are the panchkarma therapies that one can perform in case of vitiation of channel of respiration. So till here we have discussed about pranavaha srotasa, its causes, its symptoms, what kind of diseases caused due to vitiation of channel of respiration, and we have also discussed what kind of dietary and lifestyle changes one can do along with the panchkarma therapies. So this was all about pranavaha srotasa. So next is udakvaha srotasa, or the channel of fluid distribution. Let's know its causes of vitiation. So the causes of vitiation of udakvaha srotasa is consuming hot foods, drinking alcohol, suppressing thirst. So now what will gonna happen if somebody is consuming hot foods? It will lead to drying of the fluids. Then if somebody will drink alcohol, it will again leads to drying of fluids. Somebody is suppressing thirst, it will also leads to drying of fluids. But on the other hand, let's take few example of cause of vitiation. If somebody is directly go to the exposure to the sunlight, direct heat, then it will also leads to drying of fluids and person will suffer from dehydration and symptoms as you are able to see on the screen: excessive thirst, dryness in the mouth, palate, throat and lips. And on the other hand, if somebody is intaking such food that is very cold in potency, and person is intaking excessive fluids, or the person is intaking sweet, sour and salty food items, it will lead to over buildup of water or fluid inside the body. It will lead to water retentions, it will lead to blockages in the channels. Again, then it will lead to ascites like conditions. We will take a look on the further slides about the examples of channel of fluid distribution vitiation. So this was about the causes of vitiation, whether somebody is practicing such exercises that will lead to dryness of the water or the fluid, or somebody is practicing such exercises that will lead to increase in fluid inside our body, or somebody is practicing such exercising that will cause blockages. So blockages will occur when somebody will intake more kapha producing food like sweet, sour or salty food. Then comes the type of Srotadushti vitiation of body channels and their example particularly related to the channels of fluid distribution. So first one is Ati Pravriti or the excessive flow. So in Ati Pravriti, what will gonna happen? Excessive salivation, vomiting of watery fluid, excessive perspiration or the sweating. Then comes the example of obstruction or the sung. So when there will be obstruction of fluid distribution channels, so they will lead to dry mouth. Obviously there will be less water content in our body, then it will lead to dryness in the body. It will lead to dry mouth, reduced thirst sensation, blockages of the salivary duct, those ducts that secrete the saliva, blockages of those ducts. If we take example of Sira Granthi or the abnormal growth, it will lead to salivary cyst, the cyst of the salivary secretions, or the salivary gland tumor. There are the glands that produce saliva. So those glands will have the abnormal growth inside them, which is known as salivary gland tumors. Then is Vimargamna or the misrouted flow. So if the fluid will goes out of their channels, what will gonna happen? Ascites will occur. The fluid will be accumulate in the abdominal cavity. Pleural effusion, the fluid will accumulate in the pleural cavity or the cavity of the lungs, cavity outside the lungs. CSF rhinorrhea, CSF, cerebrospinal fluid. Usually its space is in the brain, in the head region. So when it flows from the nose, it is known as CSF rhinorrhea. So these are the examples of Vimargaman or the misrouted flow particularly for the channels of fluid distribution. So what are the do's and don'ts? Particularly Nidan Parivarjana, stop or cross the causes of vitiation of channel of fluid distribution. So if somebody is taking a lot of water, ask them to take water in the moderate quantity. If somebody is taking less water, again ask them to take the water in the adequate amount. Or somebody is practicing excessive exercise also, that will also lead to dehydration, because excessive sweating will occur. It will lead to dryness of the fluids inside the body and further leads to the less amount of water content or the fluid inside the body. So ask them to prefer hydrating and cooling foods, drink coriander and fennel seed water. So basically ask them to intake sweet, sour and salty food item. That will increase the kapha inside the body. Kapha is responsible for the fluid. So ask them to intake kapha increasing diet in the moderate quantity. Also ask them to intake the fruits which are high in water content like watermelon, muskmelon, or ask them to take cucumber, that is also high in water content. Then comes the don'ts. In don'ts, ask them to avoid alcohol and caffeine, avoid excessive sun exposure, avoid salty, spicy and dry food. Majorly the pungent food, spicy food and bitter food. That will be going to reduce the fluid content. So ask them to avoid bitter, pungent and astringent food item more. Then comes the lifestyle changes. So ask them to do some cooling practices if there is dryness or if there is reduction in the water content in the body. Ask them to do Shitali pranayam or Shitkari pranayam. Here you are able to see on the screen, the first one is the Shitali pranayam, then second one is the Shitkari pranayam. For more information, you can also search it on YouTube. Then is avoid sour, salty and watery foods. This you need to make sure to ask to the people who is having excessive accumulation of fluid inside their body. So ask them to avoid this. Then is avoid excessive water intake without thirst. If somebody is not feeling thirst, then ask them to avoid intaking water at that time. Then comes the Panchakarma therapies that will be going to help out in case of vitiation of channels of fluid distribution. So Shirodhara or the medicated oil pouring on forehead. If there is reduced water content, reduced fluid in the body, ask them to take Shirodhara. It will calm the pitta and reduces heat inside the body. Sarva Angadhara, medicated oil pouring on whole body. It will lead to full body moistening and calming. Then is Padabhyang or the foot massage. It will grounds the vata, calms the dehydration signs. So basically when the person get dehydrated, it leads to vata aggravation inside the body. And if the person is too much dehydrated, one can also notice the vata symptoms. Tremors, you will notice the tremors, increased palpitations, and also loss of concentration. So all these are the signs of vata. So we need to more focus on the vata if the person is dehydrated. So we need to give them such kind of dietary things and perform such kind of practices which will grounds the vata or calms the dehydration signs. So this was about the Udakvaha Srotasa or the channels of fluid distribution. Now moving towards the next one, that is channels of alimentary canal or the Annavaha Srotasa. So basically what will be the cause of vitiation of these channels? Mostly the cause of vitiation is associated with the food intake. What kind of food we are intaking or how we are intaking it and when we are intaking it. So make sure to keep this in your mind that the causes of vitiation of channel of alimentary canal or the Annavaha Srotas is mainly related to the food. How we are intaking it, when we are intaking it, and what kind of food we are intaking. So first of all, if somebody is having weak digestive fire, that will lead to vitiation of channel of alimentary canal. If somebody is having excessive eating or untimely eating, if somebody is overeating or intaking the food at the wrong time, then also it will lead to vitiation of channel of alimentary canal. Eating toxic food combinations. What kind of toxic food combinations? You must have heard about wrong food combination, Viruddh Ahar. So in Viruddh Ahar, what people need to avoid? Food combinations that when we intake leads to ama formation in the body or the toxin or the endotoxin accumulation inside the body. So those food items commonly you can say, if we intake two kind of taste at the same time, if we are intaking sour and sweet food at the same time, if we are taking the sweet and spicy food at the same time, that will also lead to ama formation. If we are intaking non-vegetarian diet with the milk, that will also lead to ama formation. That is also the wrong food combination. Nowadays people are taking pizza with the cold drink, that is also one of the Viruddh Ahar. So those toxic food combination need to be avoided if somebody is having condition related to vitiation of Annavaha Srotasa or the channel of alimentary canal. About this we will talk in the do's and don'ts. So what kind of symptoms one will feel? Indigestion, anorexia, loss of appetite, or even though the weak digestive fire is also the cause, even though if the digestive fire is, hopefully you all know that the digestive fire have 4 states. Samagni, which means balanced digestive fire. Then is Tikshnagni, which means extreme digestive fire. Mandagni, which means low digestive fire, and Vishmagni, which means irregular digestive fire. If the person is having some Agni, then there will be no visheshan of the channels of alimentary canal, and the person will feel hungry at time. Person will, don't feel anything related to the indigestion. They will not feel any kind of nausea, vomiting, or the symptoms mentioned over there on the screen. But if the person is even having weak digestive fire, even having irregular digestive fire, or even having extreme digestive fire or the excessive digestive fire, they will lead to such kind of symptoms. So these all are the causes of visheshan of channels of alimentary canal. In the symptoms, you have seen nausea, vomiting, indigestion, loss of appetite. Okay, acid reflux also comes into these symptoms. Burning sensation in the abdomen one may feel. So the causes of visheshan of channels of alimentary canal includes weak digestive fire, excessive digestive fire. So in case of excessive digestive fire, one may experience the burning sensation in the abdomen, hyperacidity also. So whether the digestive fire is extensive, excessive, low, or irregular, the person will experience the symptoms. Next are the types of Srotadushti, visheshan of body channels, particularly related to Anavaha Srotas, or the channels of alimentary canal, and their examples. So Ati Pravriti, or the excess flow. Their examples are diarrhea, hyperacidity. We already seen these examples when we learned about the types of Srotadushti. Then is excessive salivation. Then comes sang or obstruction, constipation. We have also seen this example when we learned about the types of Srotadushti. Trapped gas. Definitely when there will be blockages in the GI tract, it will lead to constipation or the trapped gas. Then is pyloric stenosis. What is pyloric stenosis? In pyloric stenosis, pylorus is one of the part of the stomach, the ending part of the stomach from which the stomach get connected to the duodenum. So what will gonna happen in pyloric stenosis? The pylorus part of the stomach get, there will be obstruction due to any inflammation, due to any narrowing of that pylorus part. And what happened? These pyloric stenosis will obstruct the flow of stomach content to the duodenum. So this is pyloric stenosis. This occurs due to obstruction of channel of alimentary canal. Then is Sira Granthi, or the abnormal growth. So abnormal growths like peptic ulcers, polyps in intestine, tumors in the GI tract, these all are the examples of Sira Granthi, or the abnormal growth. Then comes the Vimargamana, misrouted flow. Fistula in ano is one of the example. Then is gastroesophageal reflux. So if the content of the stomach reflux from our mouth, that is gastroesophageal reflux. That is one of the example of misrouted flow, or the Vimargamana. Then is fecal vomiting. One may experience vomiting of fecal matter. That is also Vimargamana, misrouted flow. The movement of content of one body channel from the other body channel. So now next let's take a look into the dietary changes. What kind of dietary changes one can make if he or she is having vitiated Anvaha Srotas, or the channels of alimentary canal. So as I have told you that in this case we have to have a look on the digestive fire of particular person. So mainly there are three kind of vitiated digestive fires. One is low digestive fire, then is excessive digestive fire or extreme digestive fire, or irregular digestive fire. So in excessive or extreme digestive fire, there is the association of excess of pitta dosha. So we need to ask to the person to avoid pitta vitiating food. So basically pitta vitiating food includes the taste that is sour, salty. Okay, so we have to ask them to avoid such things, or the pungent taste one have to avoid. Excessive spicy things he or she have to avoid. And in case of low digestive fire, we have to give some kapha pacifying food, because in low digestive fire there is the association of high kapha dosha. So in this case we have to ask to them to avoid kapha vitiating diet, which means we have to ask to them to avoid more cold potency food, more stale food, on the other hand more greasy or oily food, and the tastes that are sweet, sour and salty, these tastes we have to make sure to ask to the person that you have to avoid these tastes. And whenever there will be irregular kind of digestive fire that is associated with increase in vata dosha, so we have to ask to them that you have to avoid the diet that is bitter, pungent and astringent in taste, because these are the tastes that increase the vata dosha simply. So we have to ask to them to avoid packaged food item, stale food item, the leftovers. Let's say somebody took the freshly cooked food in the morning, that is okay, but if they are keeping it leftover and they are having it in the evening, that food will vitiate the vata dosha, although it will vitiate the digestive fire. Okay, so that's why the irregular digestive fire one may experience. So we have to decide the diet of the person as per the digestive fire state, the state of the digestive fire. So here some dietary changes are written that one must take or avoid in case of vitiated channels of alimentary canal. So one can have CCFT, a tea made up of coriander, cumin and fennel seeds. To make this tea, one may have to take half TSP of each of these seeds, coriander, cumin and fennel seeds. They have to soak it overnight in the 3 cups of water, and then early morning they can do one thing, they can make it reduce by boiling it to 1 cup only, and then they can have it when it becomes lukewarm. So this tea is really very good for the digestion also. So one can also intake it to keep their digestion good. Then is drink buttermilk. So if somebody is like having kapha associated anavasota, which means somebody is having low digestive fire, they can take buttermilk by adding some black pepper or cumin powder into the buttermilk. And if somebody is having the pitta associated condition, then they can have plain buttermilk. And in case of vata associated anvasota, they can do one thing, they can intake buttermilk with the addition of that butter into it. Ask them to don't remove butter from that, intake the buttermilk as it is. Then comes intake of 1 teaspoon of cow's ghee. So cow's ghee is Tridosha Shamak, so one can intake it in case of vitiation of channels of alimentary canal. Then comes prefer easily digestible meals. That's obvious, because easily digestible meals can only correct the digestive fire. Then comes don'ts, what they have to avoid. Limit dairy products, avoid salty and spicy foods, avoid toxic food combinations. So all these things can vitiate the digestive fire. So we have to ask to them to avoid these foods, and particularly if we have to differentiate the diet of the person, then it is on the basis of their particular state of digestive fire. Then next are the lifestyle changes of vitiation of Anvaha Srotas, or the channels of alimentary canal. So basically Vajrasana is really very amazing for this. You are able to see on the screen there are 7 yoga poses for digestion: boat pose, camel pose, then is thunderbolt pose, wind relieving pose, Pavan Muktasana or Vajrasana, then is Ardhamatasya Asana. Okay, so these kind of yoga poses we can advise to the person whosoever is having vitiation of Anvaha Srotas. Then we can also ask them to avoid the suppression of natural urges. That is basically we have to ask to every person whosoever is having vitiation of any Srotas, avoid sleeping immediately after food. Okay, this is also one of the lifestyle changes that one can make. Then comes the Panchkarma therapies that can help in such cases. So Mridhu Virechana. This is basically connected with the Pitta dosha. If somebody is having extreme digestive fire, they can go for Mridhu Virechana, that will clears up the Pitta and cools the gut. Then comes Pralep or herbal paste application. So we can make a paste according to the dosha vitiation, and then we can ask the person to apply that paste over the gut area, and it will reduce the gut inflammation, balances the pitta externally if it includes the pitta pacifying herbs, such as we can advise them chandan lep, ushir lep. So the cooling lep will definitely reduce the inflammation, and definitely they will balance the pitta from external root. Then comes the dhanya amla dhara, or fermented decoction pouring. This is also really very amazing for balancing pitta and vata. This is pitta and vata pacifying in nature. So these are some kind of panchkarma therapies that can help in such cases where there is the vitiation of channels of alimentary canal. Then comes the rasvaha srotasa, channels of lymphatic system. So what kind of things can vitiate it? So here also comes the role of digestifier. Although in each of the srotasa, role of digestifier is there, that is really very important. But in some cases, like in Annavaha Srotasa, in Rasvaha Srotasa, it is really very important because it is related to the digestion of the food. It all depends upon the digestion of the food. If somebody is intaking food in good quantity, in good quality, and at the good time, when they have to take, they are taking at that time, they are taking the food that will not vitiate any of the dosha. So basically what happens when we intake the food, first come the role of Annavaha Srotasa, that is the digestive tract, the whole digestive tract. After that, what comes, that food change into the ras, that is the nutritional fluid, you can say. So at that time, why it is important to maintain the digestifier? Because the whole body nutrition is dependent upon these two things only. When we are intaking the food, if it is digesting properly, and then if it is converting into the nutritional fluid in a good way, then only our whole body will get the nutrition. That's why here the role of digestifier is really very important. So here also in Rasva Sotodushti, the digestifier plays a really very important role. So we also need to take care of the points that we have already talked about in the Annavaha Sotodushti. Along with that, heavy, oily and cold food items, excessive eating, taking too much stress, or eating at a long gap period. Let's say I am eating at this time, I have took the food in a very large quantity, and then there is a gap of long time, and then again I am intaking the food at large quantity, then it will vitiate. On the other hand, basically the food item that can vitiate the digestifier, that we have to avoid. That's it. Same like that of Annavaha Sotodushti. Then comes the symptoms of vitiation. The symptoms is also related to the digestion only. Some can feel anorexia, they cannot feel like eating something. Some can feel heaviness in abdomen, discomfort, uneasiness in abdomen, bloating or gas formation they can experience. They can also experience cramps due to the gas formation. They can also feel altered mouth taste. They can also feel general debility. So these are the things one can experience. One can also experience like feverish feeling. When there will be no proper digestion, one may experience feverish feeling. Then comes the type of Sotodushti vitiation of body channels respectively to the Rasvaha Srotasa and their examples. So whenever there will be excess flow or ati pravriti of Rasvaha Srotasa, what will be going to happen? So whenever there will be excess of lymphatic system fluid, it may lead to hydrocele. Hydrocele is a fluid filled sac that forms around the scrotum. Then is lymphocele. Lymphocele is a sac filled with lymph fluid. Then is Sang obstruction. What will gonna happen if there will be obstruction of lymphatic system channels? So then there will be lymphatic obstruction. Lymphangitis may occur. The inflammation of the lining of the lymphatic vessels may occur. Lymphedema may occur. Due to the obstruction of lymphatic flow, there may be some kind of lymphatic fluid may obstruct somewhere and it will lead to edema, swelling. Then is Sira Granthi or abnormal growth. Whenever there will be abnormal growth of immune cells, basically our lymphatic system includes the immunity system. It includes the immune cells. So whenever there will be overgrowth of these immune cells, it may lead to lymph nodes swelling. It may lead to lymphatic fluid cyst. It may lead to lymphoma. Okay, lymphoma is a overgrowth of immune cells. A cluster of immune cells collect at one place and they lead to lymphoma. Then comes Vimargaman or misrouted flow. So leakage of lymphatic fluid into surrounding tissue will be going to occur whenever there will be misrouted flow of lymphatic system channels. Then comes what kind of dietary changes one can make. Again, the dietary changes in Rasvaha Srotadushti will remain same as that of Annavaha Srotadushti, that we have to analyze the person's digestive fire, and on that basis we have to ask to them to avoid the food or intake the food. Same like that of here written the points, that in do's one may have to intake CCFT, drink buttermilk on the basis of digestive fire only, intake of 1 TSP of cow's ghee, prefer easily digestible meals, and in don'ts one can avoid excessive salads, one can avoid sour and spicy foods, one can avoid leftovers, frozen and stale food, as I have told you in the previous one, in the Annavaha Srotadushti. Milk with sour fruits, fish or salt. These are the foods that are incompatible in nature, that I have already told you in the Annavaha Srotadushti, that one may have to avoid the incompatible foods. Same like that in Rasvaha Srotadushti, one may have to avoid incompatible food items. Moving next towards the lifestyle changes. So lifestyle changes, we don't have to suppress the natural urges. We have to avoid over exercising and excessive fasting too, because that can vitiate the digestive fire. Avoid skipping meals or eating at irregular times. About this thing also I have mentioned in Annavaha Srotadushti. So the lifestyle changes, the dietary changes will remain same in case of Annavaha Srotadushti and Rasvaha Srotadushti, because we have to take care of our digestive fire in such cases. Then comes the Panchkarma therapies. So in Panchkarma therapies, one can choose Snehan or the oleation therapy, because it will lubricate or open up the channels. Then comes Swedan or sudation therapy. What it will do? It will melt the ama. Ama are the endotoxins that hinder the formation of rasa, and by melting the ama, they will improve the flow. Then comes the Basti or medicated enema. Basti is one of the important chikitsa or important treatment in Panchkarma, because it is said that half of the treatment we can done 50% treatment with the Basti only. So 50% of diseases we can sort out with the Basti, okay, because it cleanses our gut. It is said that mostly all the diseases originate from the gut. That's why it is said that Basti is one of the important treatment in Panchkarma therapies, and we can resolve 50% of diseases with Basti only. Then next come the Raktavaha Srotadushti, or channels of vascular system, you can say. So what are the causes of vitiation of Raktavaha Srotadushti? So first of all, let me recall you, as if you already know about this, if you are the students of Ayurveda or if you are practicing Ayurveda, you already know that Rakt is closely related to the Pitta, because Rakt is the site for Pitta. So whenever there will be increase in Pitta, it will vitiate the Rakt. So we have to take care of the diet that will vitiate the Pitta. So basically the sour, salty and the pungent food items, we have to ask to the person to avoid it. On the other hand, we have to ask to them that you should not intake too much food at once, because it will create toxins in the body, and the endotoxin will also vitiate the Rakta. On the other hand, hot foods or drinks need to be avoided. Spicy or acidic food need to be avoided, because these will vitiate the Pitta. Then exposure to sun. A lot of exposure to sun may also aggravate the Pitta. Also, mental status, directly affect our body status. So if somebody will take too much stress, if somebody will become more aggressive, if somebody will feel more jealous, so all these things will vitiate the pitta. Then comes the symptoms of vitiation. So symptoms are closely related to the blood. Okay, so it will vitiate the blood. It will directly leads to various kind of skin diseases. Mostly, if there will be vitiation of rakta or vascular system, there will be skin diseases may occur and bleeding disorders. These two kinds of things one may experience. Here are some symptoms mentioned over here. Pimples, hemorrhage, acne, you can say, eczema, psoriasis, all comes under this. Skin diseases and bleeding disorders. One may experience too much bleeding in such cases. Then moving towards the examples of vitiation of body channels, types of Srotadushti related to respectively Raktavaha Srotasa. So if there will be excessive flow, one may bleed in excess. So it may be bleeding from the nose, which is said to as epistaxis. Hemophilia. Hemophilia is basically a genetic condition in which there will be less formation of clotting factor. Basically, hemophilia is of two types, hemophilia A and B. So in case of hemophilia A, there will be less of clotting factor number 8, and in hemophilia B, there will be less of clotting factor number 9. So in such cases, there will be less clotting factor, and obviously the prolonged bleeding will be seen in such patients, and this is a genetic condition, and in this case mostly males are affected. Females can be the carrier because in this case there will be mutation in the X chromosome. Then comes the Sangha or obstruction. Due to this, what happened? Arterial stenosis. Arterial stenosis is basically a condition in which there will be narrowing of blood vessels. Due to that, there will be stagnation of blood. There will be rapid collection of cholesterol over there. The blood flow will get hampered, and there may be cholesterol deposition. Atherosclerosis may occur. Then comes varicose veins. Varicose veins is basically a condition in which there will be inflammation of the blood vessels, or the vessels or veins may get twisted. So due to that, there will be pooling of blood over there, stagnation of blood over there, and we can see the varicose veins from outside because there will be dilated veins in such case, or twisted veins we can see from the outside. It is mostly usually we come to see in the people whosoever work with long standing or somebody who is obese in nature. So these kind of person may experience varicose veins. Then comes Sira Granthi or the abnormal growth. So in case of abnormal growth, one may develop hemangioma. Hemangioma is basically a cluster of blood vessels. Cluster of blood vessels will occur over there. It is benign kind of tumor. Then comes vascular malformations. In vascular malformations, basically there will be different kind of cluster of blood vessels we can able to see. So in arteriovenous malformation, what happened? Arteries and veins tangle together to form a hemangioma-like structure. Then comes Vimargamana or misrouted flow. In misrouted flow, there will be arteriovenous fistula. So in case of arteriovenous fistula, there will be a connection between artery and vein. So the flow of artery will directly goes into the vein in such cases. Portal hypertension. In case of portal hypertension, what occurs? Basically, portal is related to liver only. So portal veins are the veins that provide blood flow to the liver. So whenever there will be cases related to the liver cirrhosis is there, liver fibrosis is there, the advanced liver conditions are there, then it may lead to extreme pressure in those portal veins. So that will lead to the portal hypertension. And why it is written that there will be misrouted flow in such cases? Because whenever there will be more pressure, these veins may burst out and leads to bleeding in our esophagus. So due to that, one may experience blood vomiting. Then comes the dietary changes. In dietary changes, we need to take care that we have to give the pitta pacifying diet, and we have to make sure that the person may avoid the pitta aggravating foods. Same is written over here. So in do's, one can intake coconut water, intake of 1 tsp of cow's ghee, one can intake sweet, bitter and astringent foods, because these are the food items that can pacify the pitta. On the other hand, they have to avoid sour, salty and pungent foods that can aggravate the pitta. They can intake ashgard juice, rose petal juice, marigold juice. They can even intake coriander water, coriander seeds water. They can soak coriander seeds overnight and intake in the early morning. That is known as dhanyakhyam in Ayurveda. Then comes don'ts. What they have to avoid? They have to avoid red meat, fermented and fried foods, milk with sour fruits, fish or salt. Avoid sour, salty and spicy foods, sour, salty and pungent foods in short. So this was about the dietary changes. Then comes the lifestyle changes in case of vitiation of channels of vascular system. So in lifestyle changes, one may avoid such things that can aggravate the pitta dosha. So in the causes, I have told you the exposure to sun heat. On the other hand, excessive anger and stress. Hot showers one can have to avoid. They can do Shitali or Shitkari pranayam. Also, Chandrabhedi pranayam is really very effective in such cases, because all these kind of pranayam will reduce the pitta dosha. So basically the practices that can aggravate the pitta dosha we have to avoid, and those practices that can pacify the pitta dosha we have to advise to the person whosoever is having Raktava Srota Dushti. Then is Panchakarma therapies. Panchakarma therapies that can help out in Raktava Srota Dushti. So basically those conditions or the therapies that will pacify the pitta dosha. Swedana or sedation therapy. It will open up the circulation. So it is important in case of Sroto Avrodh, or whenever there will be Sroto obstruction of the channels. Then comes the Virechana or induced purgation. So Virechana in Ayurveda is one of the best treatment for pitta related conditions. So with this, we can clear the excessive pitta from the person's intestines. Then comes the Rakta Mokshana. This is one of the best treatment for vitiated Rakta. So it will purify the blood. So by doing this, we can also see a lot of changes in conditions related to Raktava Srota Dushti. So this was about Raktavaha Srota Dushti. Next comes the Mamsvaha Srota Dushti, or the vitiation of channels of nutrition to muscle tissue. So let's talk about its vitiation, the causes of vitiation. Sleeping after eating heavy and dense food. Foods cause excessive discharge. So basically the foods or the lifestyle things that can vitiate the kapha dosha will be the causes of vitiation of Mamsavaha Srotasa. So in this case, we have to avoid more sweet, salty and sour foods that can increase the kapha dosha inside our body. We have to avoid day sleeping, that will also increase the kapha dosha. We have to avoid sleep after just intaking the food, that will also vitiate the kapha dosha. We have to avoid doing things like we are lying down on the bed whole the day, we are not moving at all, basically inactivity, that we have to avoid. We have to be more active if we want to prevent ourselves from the vitiation of Mamsvaha Srotasa. So basically the food items or the lifestyle things that can vitiate the kapha dosha will be the causes of Mamsvaha Srota Dushti. Symptoms one may experience is related to weight only, or overgrowths will be there basically. So on the other hand, if there will be depletion of such things, so basically if there will be depletion of Mamsa Dhatu, then what happen? Basically the things that may vitiate the Vata dosha, if person is having that things in more amount, then there will be reduction of Mams Dhatu. So basically we have to take care of Vata diet and Kapha diet. Do not intake more Vata diet or do not intake more Kapha related diet in such cases. So symptoms here, it is written that neck or throat swelling is there, overgrowths will be there. Basically, when there will be increase of kapha dosha over there, there will be visheshan of mamsva srotasa, and it will lead to overgrowth, and obstructions in those channels will lead to obesity like things, or heavy weight like things, or some may experience hyperlipidemia. There will be more lipid formation. Let's take a look on the examples of such conditions that may occur due to excessive flow obstruction, abnormal growth, or misrouted flow of channels of nutrition to muscle tissue. So in case of excessive flow or ati pravriti, the person may experience muscle hypertrophy. So there will be muscle hypertrophy. You can able to see big muscles. So in case of if one is a bodybuilder, you can see their muscles in a very big form. So there will be muscle hypertrophy. Tonic muscle contractions. If there will be excessive flow, one may experience more muscle spasm. Then comes obstruction. In case of obstruction, there will be fibrosis in muscles. So whenever there will be connective tissue formation in the muscle tissue, fiber-like structures form in the muscle tissue, there will be obstruction in the muscle tissue. Frozen shoulder will be there. That also occurs due to fibrosis in the muscle tissue. Then the muscle tissue will not be able to contract or relax. Due to that, one may experience frozen shoulder. They will not be able to move their shoulder joint. Then comes the Siragranthi or abnormal growth. In abnormal growth, one may experience muscle cyst, a cyst of muscle tissue, myoma. Myoma is a benign overgrowth of muscle tissue. Then comes lipoma. Lipoma again is a overgrowth of the fat tissue. So that may also occur due to obstruction in these channels, because from muscle tissue, adipose tissue will form, the fatty tissue will form. So due to that, one may also experience the lipoma. Then comes Vimargaman or misrouted flow. So whenever there will be muscle hernia means muscle is coming out from its own place. That happen whenever there will be a weak point form in the covering of the muscles. The fascia that is covering the muscle, whenever there will be a weak point in that fascia, the muscle may herniate from there. Okay, that is the example of misrouted flow. Then is congenital myopathies. So these myopathies means somebody is having some defect from the birth only, that is congenital. So this may also occur from the misrouted flow. Then comes the dietary changes. What kind of dietary changes one can do? So basically there will be the increase of muscle tissue in such cases. Then they have to intake the food item that can reduce the kapha dosha. They can intake the honey, they can intake warm water, light and warm foods, bitter, pungent and astringent taste. These are the dietary changes that one can do in such cases whenever there will be excess of muscle tissue or excessive flow of nutrition to the muscle tissue. Then comes the next thing, whenever there will be involvement of vata dosha over there, the muscle depletion is there. In such cases, one can intake the things that may increase the kapha dosha. So that we have to analyze in the patient and then we have to advise to them. Then comes the don'ts. What kind of things they have to avoid? They have to avoid red meat, dairy products, heavy and oily foods, sweets or salty foods. Basically, the connection of kapha dosha is with these channels. So that's why we have to advise the diet that will reduce the kapha dosha, and we have to avoid the diet that will increase the kapha dosha. Then comes the lifestyle changes. Again, lifestyle changes. In such cases, I have told you that the person who lie down all day, whosoever is practicing inactivity, that may experience such kind of things. So in those cases, we have to ask to the person to do brisk walking or cardio. Then we have to advise to them Kapalbhati or Bhastrika pranayam, because these practices will reduce the inactivity. These practices will reduce the kapha dosha by making the person more active. Then comes the Panchkarma therapies that will help out. Vamana, induced emesis, expels excessive kapha. So this condition happened due to excess of kapha dosha. That's why in case of this, Vamana is one of the best treatment, because in Panchkarma therapies, Vamana is preferably done in case of high Kapha dosha. Then comes Udvartana or dry powder massage. So if we do the dry powder massage externally, it will scraps out the excessive tissue like the moles, as you are able to see over the screen also. Then comes Kshar Karma. Kshar Karma is also for the external overgrowth, same like that of mole or any kind of external growth you can say. Then comes the Medo Vaha Srotadushti. Same like that of we already connected the Anava Srotadushti with the Rasavaha Srotadushti. Same like that is the Mansvaya Srotadushti and Medovaya Srotadushti. The cause will be the same, the increase of the Kapha dosha. So in this also, as you are able to see over the screen, if somebody will do lack of exercise, daytime sleep, overexertion, fat increasing food, so this will vitiate the nutritive channel for adipose tissue. So the examples of causes of vitiation are the same. The causes for vitiation of Medovaya Srotasa is also same as that of Mamsvaya Srotasa. So the heavy, greasy, oily food will also vitiate it. The sweet, sour and salty food will also vitiate it because they will increase the Kapha dosha. Then come symptoms of vitiation. What kind of symptoms one may experience? One may experience excessive thirst, excessive sweating, heaviness in the body, discomfort. They will feel like not to move, laziness will be there, inactivity will be there, they will feel like they don't want to do anything. Then comes the types of Srotadushti, vitiation of body channel respectively to Medovaya Srotasa. So in such cases, if there will be more med means more fat will lead to a fatty person. So here comes the examples: obesity, fatty liver disease, fat will also accumulate over the liver. Then comes hyperlipidemia, which means more lipid production. Then comes Sangor obstruction. If there will be obstruction of adipose tissue, atherosclerosis will occur. So the cholesterol will deposit in the arteries. So over there, those cholesterol deposits will lead to atherosclerosis, which means they will absorb the calcium and then they will become hardened and leads to atherosclerosis. This is due to the obstruction. Then is cholecystitis. In cholecystitis, there is the inflammation of gallbladder that also occurs due to obstruction in the some duct of the gallbladder. Then comes Siragranthi or abnormal growth. Cystic lipoma one may experience, that we have discussed in case of muscle tissue also. So fat tissue will accumulate at one side, forms the lipoma structure. Then comes fatty cyst, a cyst of fat cells. Then comes Vimargaman or the misrouted flow. So what will happen if there will be misrouted flow of nutritive channel for adipose tissue? So fat deposition in the subcutaneous tissue. Subcutaneous tissue means that is beneath the skin. So there will be fat deposition. Then comes the dietary changes. Again, the dietary changes will remain as that of Mamsavya Srotadushti. So in those, one may have to intake honey, warm water, light and warm foods, bitter, pungent and astringent tastes. So they have to intake such things that will reduce the Kapha dosha. Then comes don'ts. They have to avoid red meat, dairy products, sweet, sour and salty food items, heavy and oily and greasy foods they have to avoid. In lifestyle changes, they have to make themselves more active. They have to avoid long sittings. They have to say no to sleeping after meals. They have to avoid late nights or irregular sleeps. So all the causes that will vitiate the Kapha dosha are closely related to the vitiation of Medovaya Srotasa, so they have to avoid such things. Then comes the Panchkarma therapies. Again, the Panchkarma therapies will be mostly same as that of Mamsavya Srotasa. Two of them are same: Vamana, that is induced emesis, that will expels out the excessive kapha by the oral route in the form of vomiting. Then comes Udvartana or the dry powder massage. It will scraps the excessive fat. Then comes Svedana or sedation therapy, which means it will melt the ama and open up the channels. So this was about Medovaya Srotasa. So now next let's discuss about Asthivaya Srotasa or the channels for bone tissue. We will have a look on causes of vitiation and symptoms of vitiation of Asthivaya Srotasa. Same like that of Rakta and Pitta relation, there is a relation of Vatosha with Asthivah Srotasa. Vata dosha basically have a site as a Asthivah Srotasa. So whenever there will be increase in Vata dosha, there will be depletion of Asthi or the bones or the joints. It is totally opposite to that of Rakta and Pitta. So whenever there will be Visheshan of Pitta dosha, there will be Visheshan of Rakta dosha. But here, whenever there will be increase in Vata dosha, the Asthi dhatu will deplete. So first of all, we have to take care of the diet that will increase the Vata dosha. That means bitter, pungent and astringent taste. These three tastes should be avoided in case of Visheshan of Asthivah Srotasa. So this is the dietary part, but along with that, this is also one of the cause of Visheshan of Asthivah Srotasa. The diet, which includes bitter, pungent and astringent taste. On the other hand, there will be more causes such as trauma or injury, as you are able to see over the screens, excessive agitation, excessive exercise. So if a person will utilize their joints more, then also there will be Visheshan of channels for bone tissue or the Asthivah Srotasa. If there will be excessive use of joints, these are some of the causes of Visheshan of Asthivah Srotasa. Then comes symptoms of Visheshan. So whenever there will be something wrong with our bones or joints, there will be pain, there will be stiffness, there will be inflammation also, there will be reduced range of motion. Somebody will not use their joints as effectively as they can due to Visheshan of Asthivah Srotasa. Also, if there will be injury or trauma, some may experience bone fractures or bone sprains will be there. Then comes overgrowth of bone. If somebody is having that diet, that will nourish the Asthivah Srotasa. If somebody will have more diet, that will nourish the Asthivah Srotasa, like calcium supplements, you can say, or vitamin supplements. So that will leads to overgrowth of bone. Then comes the type of Srotadushti Visheshan of body channels, particularly related to Asthivah Srotasa and their examples. So if there will be Ati Pravriti or excess flow of these channels, if there will be more nutrition to the bony tissue, then what happens? There will be extra bone development. So here the examples are bone spurs. This is extra bone development. Then comes malocclusion of teeth. Somebody have more teeth, more than 32 teeth. So that is also the example of excess flow. Then comes sung or obstruction. If there will be obstruction, there will be bony fusions created. Then is herniated disc. Then is arthritis will be there if there will be obstruction. Then comes Sira Granthi or the abnormal growths. What kind of abnormal growths one can see? One example is osteoid osteoma. This is one of the benign tumor, you can say. Then is bone tumors. Then comes osteochondroma. This is also one of the benign tumor. Then comes Vimargaman or misrouted flow. Whenever there will be Vimargaman, one may experience dislocation of bones and joints. So these are few examples related to type of Srotadushti, respectively for Asthivah Srotasa or the channels for bone tissue. Now comes what kind of dietary changes one can make. So whenever there will be, Dushti of Asthivah Srotasa, first of all, we have to make sure that the person may avoid the things that is bitter, pungent and astringent in taste, because it will vitiate the Vata dosha, it will increase the Vata dosha, and on the other hand there will be decrease in the bony tissue. So that's why we need to make sure that the person will take those things in moderation, or if there is a more worsened condition, then they can avoid these tastes, because they will further increase the Vata dosha. There will be increase in pain, there will be increase in stiffness and inflammation. So whatever the symptoms one may experience in case of Visheshan of Asthivah Srotasa will get increased. So make sure to avoid the things that is bitter, pungent and astringent in taste. Then comes one can have 1 TSP of cow's ghee. So cow's ghee is very effective in balancing the Vata dosha. So we can guide those people to have 1 TSP of cow's ghee on daily basis. Even on the basis of their condition, they can have it in a more amount. That we have to analyze patient to patient. Then comes calcium rich foods such as milk. So first of all, we all know this is a very basic thing, that calcium is very much needed for the bone formation. This is the primary thing for the bone formation. So we need to prescribe the calcium rich foods. On the other hand, vitamin D3 is also very essential because it helps in the absorption of calcium. Whenever there will be low vitamin D3, there is nothing work whenever the person is taking calcium supplements. So vitamin D3 in adequate range is must if we are giving calcium rich foods to the person. So that's why in lifestyle changes one can also take morning sunlight. That is very good source for vitamin D3, a very good natural source for vitamin D3. In don'ts, what they have to avoid, first of all, that I have said that you need to make sure to avoid the things that is bitter, pungent and astringent in taste. On the other hand, limit cold and frozen foods. This will also increase the Vata dosha. On the other hand, deplete the bony tissue. Then comes lifestyle changes. So adequate rest is needed. In case if there is depletion of Asthivah Srotas, adequate rest is needed. Because if they will give more friction to the joints, it will then again deteriorate it. So adequate rest is needed. Sun bath for 10 to 15 minutes in morning. The same thing that I have told you earlier. Next thing is Asthivah Srotasa Panchkarma therapies. So what kind of Panchkarma therapies can be done? So basically here it is mentioned about the localized basti. So in case of localized basti, we can advise the basti of particular area that is affected. So if their knees are affected, then we have to advise them Janu basti. It will nourish the joint and allows its movement. What is actually the basti, localized basti? We need to create around, as you are able to see over the screen, we need to make a pit over the knees or over the neck or over the spine, wherever your bones are getting affected, wherever there is a depletion of bones or there is pain, stiffness or injury to the bone. We can make a pit with the urad dal dough. So with that we need to make a pit and then we have to pour the oil. So this kind of oleation therapy is advised in case of visheshan of Asthivah Srotas or wherever the bones and joints are involved. In those cases one can do localized basti. So same like that, Kati basti is mentioned over here, that is pelvis oleation therapy. In this one may have to provide the oleation again. This procedure maximum take 30 to 45 minutes and we have to make sure to ask the patient to avoid going to the direct exposure of air and also avoid taking things that can increase the Vata dosha. Basically light food is advised, that is warm in nature, that is Vata pacifying in nature. We can also ask them to add a little bit of black pepper to their food, so that will be really very helpful for after procedure care. Then comes the Majjavaha Srotasa. Till here we have discussed about Asthivah Srotasa. Now comes the Majjavaha Srotasa, nutritive channel for bone marrow. So what are the causes of vitiation for nutritive channel for bone marrow? Due to any injury, due to crushing of bone, incompatible food consumption. So also this bone marrow is related to nervous system. The Majjavaha Srotasa related to the nervous system. So we need to make sure to avoid the things that will increase the Vata dosha, because Vata dosha is directly correlated with the Majja. Also we need to take care of any injury, of any crushing of bone, because bone marrow, the channels of bone marrow remains inside the long bones. Bone marrow is inside the bone, so we need to take care of the health of the bone too, because if the bone health will be good, then only the bone marrow health will be good. So we need to avoid the things that may vitiate the Vata dosha. Okay, and on the other hand, the causes of vitiation include injury, crushing of bone and incompatible food consumption. What kind of symptoms one may experience? One may experience dizziness, fainting, mental confusion. So all the symptoms that are related to the nervous system. Also, one may experience pain or stiffness in the bones. Whenever there will be injury or crushing of the bone, this may happen. That's really very clear. So next comes the types of Srotadushti, Visheshan of body channels respectively to Majjava Srotasa and their example. First one is Atipravritti or excess flow. What gonna happen? So first of all, for knowing the examples of Visheshan of Majjava Srotasa, we must know what is the role of Majja Dhatu in our body. So basically, Majja Dhatu helps in the formation of blood cells. RBCs, WBCs, platelets, mainly these three things form in the Majjava Srotasa. So Majjavaha Srotasa also related to the immunity. So whenever there will be excess flow of this Majjavaha Srotasa, what gonna happen? There will be overproduction of blood cells, leading to polycythemia vera. In case of polycythemia vera, what happens? There is a massive increase in RBCs. Thrombocytosis. There will be massive increase in platelet count, and the person may experience thickening of blood. There will be more blood clotting, and due to blood clotting there will be blockage in the blood vessels, and one may also leads to some kind of heart disease as well. Also, if there will be obstruction in these channels, what's gonna happen? Osteomyelitis will happen. Osteomyelitis is basically an infection due to fungi or bacteria. Then comes bone marrow fibrosis. So a fibrous tissue will form in the bone marrow. It will again affect the production of blood cells like WBCs, platelets and RBCs. Then comes Siragranthi or abnormal growths. In abnormal growths, one may experience bone marrow tumors, multiple myeloma, nodules. Then comes Vimargaman or misrouted flow. In case of misrouted flow, bone marrow embolism will be there. What happens in bone marrow embolism? The tissue of bone marrow goes into the blood capillaries or artery, and they further lead to obstruction there and leads to various kind of disorders. Then comes extramedullary hematopoiesis. So the production of RBCs happen extramedullary, which means out of the bone marrow tissue. So these are the various example of vitiation of body channel respectively related to Majjavaha Srotasa. Now what kind of dietary changes one can make, what kind of pathya apathya one can follow, do's and don'ts one can follow in case of Majjava Srotadushti. So one can have 1 TSP of cow's ghee, include sesame seeds, walnut, chia seeds. So basically the diet that will ground the Vata dosha, that will calm the Vata dosha, those things we need to give to the person who is having vitiation of Majjava Srotasa. What kind of things one can avoid? Limit salty foods. Also one can limit bitter, pungent and astringent food, avoid alcohol and smoking. Then comes lifestyle changes. Lifestyle changes include sun salutation, avoid excessive sleep and lethargy. Sun salutation, again, it will help in increase in vitamin D3 that can nourish the bone. Then further, they will nourish the bone marrow. Then comes the Panchkarma therapies. Basically, the therapies that will calm the nervous system we need to do. So that's why here it is written about Shirobhyang, that is head massage, nourish and rejuvenated the nervous system, and Shirodhara, pouring of oil over the head. This is a very excellent and very easy procedure for the patient to do that will helps to calm the nervous system. Or it is also really very effective for the conditions that is directly related to diseases of upper clavicular region. Means the diseases that occur above the clavicle bone. Then comes the Shukravaha Srotasa, nutritive channel for reproductive tissue. This is basically related to the males. So what kind of causes that will leads to its vitiation? Excessive sexual intercourse, or excessive masturbation, or suppression of sexual urges, untimely sexual intercourse. So the causes of vitiation are related to the sexual activity only. Then comes symptoms of vitiation. What kind of symptoms one may experience? So loss of masculinity, infertility or impotence, loss of sexual vitality, weak or diseased offspring. So these kind of activities will lead to depletion of Shukra Dhatu. So further it will lead to weak or diseased offspring also, baby. Okay, so in case if they are not indulged into the sexual activity, they are not ejaculating their sperms, it will lead to sperm stones. Okay, so moderation of sexual activity is needed to maintain the health of Shukravaha Srotasa. Then comes the type of Srotadushti vitiation of body channels, particularly related to the Shukravaha Srotasa. So when there will be excessive flow, it will lead to premature ejaculation, polyspermia. Polyspermia is basically a condition in which there is a huge number of sperms, and that may lead to surge into the ovum, which means more than one sperm may surge into the ovum and it may lead to failed fertilization. So this is also one of the example for excessive flow. Then comes hypersexuality. One may need to indulge into the sexual activity all the time in case of hypersexuality. Sangha, when there will be obstruction in these channels, azoospermia will happen, oligospermia will happen, ejaculatory duct obstruction will happen. Now what is azoospermia and oligospermia? Azoospermia is basically a condition in which there is no sperm in the semen, and oligospermia is a condition in which there is less number of sperms in the semen. So this may develop when there will be obstruction in these channels. Sira Granthi or abnormal growths. The number one is spermatocele, which means a cyst that is filled with the sperms. Then comes epididymal cyst and testicular tumor, tumor in the testis, and epididymal cyst. Epididymal cyst is a condition in which there is a fluid-filled sac forms in the epididymis. Epididymis is basically the lining of the testicles. So next is what happens when there will be vimargaman or misrouted flow. So retrograde ejaculation will be there. Semen may appear in the urine, or urethral fistula will be there. Now what is retrograde ejaculation and urethral fistula? So now what is retrograde ejaculation and urethral fistula? Retrograde ejaculation is the condition when the sperms goes into the urinary bladder. On the other hand, urethral fistula is a condition in which there is a connection of urethral pathway to some other organ, maybe to the skin. Okay, so the urine may pass out from the skin in such cases. Then comes do's and don'ts in case of Srotadushti of Shukravaha Srotasa. So we need to give nourishing and unctuous diet. Include omega-3 fatty acids. So whatever is nourishing in nature we need to give. So we need to basically give the rasa that are nourishing in nature, which means a sweet taste is very nourishing in nature. So we need to give the thing which are sweet in taste. So on the other hand, avoid the things that are more bitter, pungent and astringent in taste, because that will vitiate the vatosha and it will deplete the shukra or the sperms, you can say. Avoid alcohol and smoking. Any kind of addiction is not good for such conditions. They may deplete the sperm count, so we need to make sure to make the patient to avoid the alcohol and smoking or other addictive things like tobacco and all. Also limit packaged and processed foods. Then comes lifestyle changes. So regular yoga practices, also Kegel exercises that are basically related to the pelvic muscles is very effective in such cases. Even though in females also, for the female reproductive health as well as for the male reproductive health, Kegel exercises works really effectively. Then comes pranayam, so breath control. Obviously meditation works well for each and every kind of Srotadushti, so we can advise this. Stress factor is also one of the cause of Srotovahadushti. So we need to make sure to advise people who are taking more stress to do pranayama on daily basis. Then comes the panchkarma therapies that will help in case of Shukrava Srotodushti. So Uttar Basti, medicated enema through urinary route, is really very effective in such cases. It will nourish and lubricates the urogenital tract in males. Then comes Snehan, oleation therapy. So oleation therapy will provide strength and vitality. That's why it is really very effective in such cases. So this was all about Shukravaha Srotodushti. Now next we are moving toward the Mutravaha Srotodushti, or the Srotodushti of channel for transporting urine. So what will be their causes? Basically suppressing the urine urges, excessive intake of water, inappropriate food, or maybe some kind of diseases such as diabetes, mellitus, and one can also experience the dushti or visheshan of channel for transporting urine in case whenever somebody intake more pitta diet, because more pitta diet will lead to further inflammation of urinary tract, urinary bladder. So this will leads to burning sensation while urinating, also decrease in urine. Also it may further lead to UTI like conditions. So causes of visheshan for this may also include the bacteria or viruses. Then come symptoms of visheshan. So in case of symptoms, there will be urinary retention, as you are able to see over the screens. One more thing, burning micturition that I have told you, or stiffness in urinary passage and urinary bladder obstruction, as here it is written in the symptoms. Also one may experience decreased urination or increased urination. Then comes types of Srotodushti or visheshan of body channels, particularly related to Mutravaha Srotasa, or the channels for transporting urine. So if there will be excessive flow, it may lead to polyuria. A person is going to pass urine again and again, very frequently. Then comes diabetes insipidus. This is also such condition in which person experience frequent urination and feels like every time to urinate. Then is nocturia, more urination at the night time. This is also very common in case of diabetes insipidus and also in diabetes mellitus. Then comes sung or obstruction. Whenever there will be obstruction, what a person may experience, urinary retention will be there, urethral stricture will be there, kidney stones may occur due to obstruction. Then comes Sira Granthi or abnormal growth. Whenever there will be abnormal growth, it may lead to bladder tumor, renal cyst, urethral polyp. So any kind of overgrowth may develop if there will be misrouted flow. So in case of misrouted flow, basically there will be a formation of fistula, a tract. Maybe that tract may develop from urethra to other organ, maybe from bladder to other organ. So as you are able to see over the screens, vesico-vaginal fistula. This is a fistula in which what happens, a urinary bladder and vagina develop a route from which urine may pass from the vagina. Then comes urethrovaginal fistula. In this case, there will be a path created, there will be a fistula created from urethra to vagina. So it also leads leakage of urine from vagina. Then comes urine in stool. Urine in stool may occur due to colovesical fistula. In this case, what happens? A fistula may develop that connects the colon and the urinary bladder. So in this case, one may experience urine in stool or stool in urine also. Vice versa, you can say. Or gas also may pass from the urethra. Then comes the dietary change. What kind of dietary changes one can do? One can stay hydrated, take cooling foods. Cranberry juice is very, very effective for such kind of cases in which there is visheshan of urinary tract. CCFT is also very good. So one may have to basically take pitta pacifying diet. Why? Because in this area, the pitta may lead to inflammation. In case of urinary tract infection also, cooling things work. Also cooling things act as diuretic also. Warming things also act as diuretic In that case, CCFT is one of the best thing to have. And cranberry juice is really very effective in case of UTIs whenever there is infection in case of urinary tract. Don'ts. What kind of things one have to avoid? They have to avoid oily and spicy foods. Again, the things that may vitiate the pitta dosha, caffeine and alcohol. Okay, so such kind of food item that may vitiate the pitta dosha, one may have to avoid. Then comes the lifestyle changes. Avoid holding urine. So suppression of urine is one of the most common thing that may vitiate the Mutravaha Srotasa. So avoid doing this, or also advise to your patients whenever you will be going to practice. Advise your patient to avoid holding urine. Sitz bath to relax pelvis muscles. Also, sitz bath may help in reducing the infection also and inflammation in the urethra also. Then comes Mutravaha Srotasa Panchkarma therapies. So what kind of Panchkarma therapies may help in vitiation of Mutravaha Srotasa? Uttar Basti, that I have also told you in case of Shukrava Srotodushti. So this is one of the Panchkarma therapy that may help it. Also Avgahan also help. Avgahan is same like that of sitz bath. In case of sitz bath, we have to dip just our lower pelvic region into the warm water. Okay, and in case of Avgahan, we have to dip the whole body, but in such cases we need to just do the sitz bath. That will help in such cases. This is all about Mutravaha Srotodushti. Now comes the Purishva Srotodushti, or the vitiation of channels for transporting fecal matter or feces. Then comes what are the causes of vitiation for this and symptoms of vitiation for this. So Purishva Srotodushti will be there whenever there will be obstruction in these channels, whenever somebody is not intaking food in a good quantity or quality, whenever somebody intake the food item that may create arm dosha, because that will also obstruct the channels. Also somebody is not taking enough fibers in their diet. So also excessive eating or obstruction in that area. Indigestion is also one of the cause of vitiation of Purishvaha Srotasa. So basically related to the eating habits or food habits, or what kind of food somebody is having, at what time they are having the food, that will affect the Purishvaha Srotasa, because stool forms on that basis. What we eat, how we eat, when we eat. So symptoms one may experience: watery stool, foul smelling stool, constipation may be there, gurgling or rumbling sounds will be there. Now next, some may experience gases also, some may experience pain also, abdominal pain or lower belly pain will be there. So what kind of type of Srotodushti and their examples we are going to learn now. What kind of Srotodushti will be there? It is of 4 types, whatever is happening in all kind of Srotasa. So what kind of diseases that may leads to, let's discuss. So in case of Ati Pravriti or excessive flow of Purishvaha Srotasa, basically they are related to the fecal matter. So obviously if there will be excessive flow, some may experience diarrhea, irritable bowel syndrome, okay, and lactose intolerance will be there. Then comes Sangha or obstruction. In case of obstruction, there will be constipation, trapped gas will be there, fecal impaction, which means hard dry stool obstructing the rectum area, and intestinal obstruction. Then comes Sira Granthi or abnormal growth. One may experience ulcers, one may experience polyps. So colorectal polyps and colon cancer is mentioned over here. Then comes Vimarkaman or misrouted flow. Again the fistula that we have discussed in case of Dushti of Mutravaha Srotasa. So there will be colovesical fistula, which means fecal matter comes into the urine. The fistula that develop in between the colon and the bladder. Then comes the diverticulosis. So in this condition, what happens, where there will be a weakened point in the wall of the colon or the intestine, a pouch will comes out from that lining. A pouch will develop. So on the other hand, rectal prolapse is also a condition that is related to the misrouted flow of channels for fecal matter, or the channels that transport fecal matter. So rectal prolapse. In this case, what happens, the rectum muscles may comes out. So this is having some grades, grade 1, grade 2, grade 3, grade 4, on the basis that in grade 1 simply there will be prolapse comes out on their own while passing the stools, and it will go on their own. In case of grade 2, the rectal prolapse will comes out, but it goes easily with the help of finger. In grade 3, what gonna happen, the mass will not goes inward. So such kind of grading is given to the rectal prolapse on the basis of the mass coming out and going inside. Then comes the dietary changes. So basically the dietary changes will be related with the food only. So what kind of food the person is having, dietary changes is related to how we are intaking the food, when we are intaking it, and what kind of diet we are having basically. So hydrating food is needed, easy to digestible meals, fiber rich food. In case of obstruction or constipation, one can take. Avoid dairy products. In case of lactose intolerance, avoid dairy products. Also, if there is diarrhea, avoid dairy products because it may again leads to more motions. Heavy, spicy and oily foods. So basically the area, the intestines is the place for pitta dosha. So that's why it is advisable to intake the diet that will balance the pitta dosha, the cooling things one can have. Again, the lifestyle changes. Avoid sedentary activities. Avoid ignoring the urge to have a bowel movement. This is also one of the basic things that one may have to change because it will cause the vitiation of such channels. So basically, what are the functions of all these channels? We need to take care of those functions, and whatever the natural urges are related to those channels, we need to take care. Do not suppress those urges because they will again vitiate those channels that are associated with those urges, and they are number one cause of their vitiation. Then comes the Panchkarma therapies that may help out in vitiation of Purishva Srotasa, in getting rid of vitiation of Purishva Srotasa. So viration. It induced purgation. In case of constipation, it is really very effective. So it will cleanse the digestive tract and restore the balance. Then comes basti or medicated enema. Yes, again, this is one of the best therapy for these channels because it will nourishes and lubricates the colon. It will provide the strength to the colon. In case of whenever there will be rectal prolapse or whenever there will be ulceration or piles in the rectal area, sitz bath also works really good. If we add Panchvalkal Kwath into that water in which the person is going to take the sitz bath, the water that the person will be going to use for the sitz bath, that is really very effective in such cases because it provides strength to the rectal muscles. Also, it will heal the ulcers or heal the dilated rectal veins in case of piles. So till here we have discussed about Purishvaha Srotasa. Now we are going to discuss about Svedvaha Srotasa, or the channels for transporting sweat. So in this case, what kind of causes will be there? So first of all, Vat dosha, Pitta dosha, Kapha dosha, these three will be related to its vitiation. If there will be more Vat dosha, then there will be reduced sweating or no sweating. If there will be Kapha dosha, then there will be sticky sweating. If there will be more Pitta dosha, there will be excessive sweating. So we need to take care to have everything in moderation. Basically, Pitta dosha predominantly related to this, and Kapha dosha role is also there if there will be some blockages and all. So let's discuss about causes. So basically vata increasing diet one may have to avoid, or to intake the diet that is in moderation, like it will not increase the vata dosha, pitta dosha or kapha dosha basically. But moreover, the angry mood or whenever there is more stress, it will also vitiate it, which means the emotional imbalance will also leads to vitiation of these channels for transporting sweat. Overheating, whenever there will be more sun exposure, it will also leads to vitiation of channels for transporting sweat whenever there will be fear or anger. Then come symptoms. Symptoms will be related to the skin only. Somebody will feel if there will be moist sweating or sticky sweating. Somebody will experience burning sensation, dryness of skin, excessive sweating, excessive salivation or fluid discharge. So all these symptoms will be basically related to the vata dosha, pitta dosha and kapha dosha. If there will be more vata dosha, there will be no or less sweating, then it will lead to dryness of skin. If there will be more pitta dosha, due to that there will be excessive sweating and one may experience burning sensation. If there will be more kapha dosha, there will be more salivation also, and there will be more fluid discharge also due to this. So now comes the types of Srota Dushti related to the Swedva Srotasa. Ati Pravriti, whenever there will be excessive flow, so one may experience oversweating, or the term is known as hyperhidrosis. Whenever there will be obstruction, there will be no sweating or very less sweating. No sweating means anhidrosis. Less sweating means hypohidrosis. So this will be due to blocked sweat glands. If there will be abnormal growth or Sira Granthi, it will lead to conditions such as hidradenitis suppurativa. Whenever there will be abnormal growth, it may lead to sebaceous cyst or carbuncles. Then whenever there will be misrouted flow or the vimarka gamna, sweat may comes from the eyes, ears or mouth. So these are some of the example of type of Srota Dushti in case of Swedvaha Srotasa. What kind of dietary changes one may have to do? So basically it is related to the Pitta dosha. So one may have to intake the food items that will balance the Pitta dosha, reduce the Pitta dosha. We have to ask them to take cooling things. We have to ask to them stay hydrated and take warm and moist foods. Whatever they have to avoid is dry, raw or cold foods, cold drinks, iced water, ice cream, because these things will vitiate the Pitta dosha. So we need to make sure in case of whenever there is heavy sweating, we need to make sure to avoid these things. Then comes the lifestyle changes. So steam therapy will help out. We have to make sure to give the steam therapy of whole body. So steam spa we can advise to the people. It will help to clear the blockages from the sweat glands, then further reduce the cases of anhidrosis or hyperhidrosis. In case whenever there is anhidrosis or hyperhidrosis, we can ask them to do vigorous exercises. Then comes Panchkarma therapies. So in Panchkarma therapies also Swedan or sudation, which means again steaming. So direct sudation, direct Swedana will stimulate and open up the blocked channels. And Pijichil means medicated oil bath that will promote the natural sweating. So this is also helpful in case of anhidrosis or hypohidrosis. In case of hyperhidrosis, when there is more sweating, we need to give pitta pacifying treatment. So Virachan can be advised in such cases. Also we can advise them to do the pranayam related to moon bathing. They can do meditation under moonlight. So it will reduce the Pitta dosha. They can also do Sheetakari or Sheetali pranayam. That will also reduce the Pitta dosha. So we can advise them these things. Next, moving toward to the Artava Srotodushti, or the channels carrying menstrual blood. So what will gonna happen when there will be vitiation of these channels? First of all, let's know about its causes of vitiation. So the causes of vitiation for Artava Srotodushti will be hot foods. Basically, these menstrual blood carrying channels are related to the hormones, and hormones in Ayurveda is related with the Pitta dosha. So we need to take care of the diet that will vitiate the Pitta dosha. Also, the sedentary lifestyle is one of the most common cause for such vitiation. In these cases, moreover, nowadays ladies or females are experiencing PCOD, PCOS, such kind of things that are leading to menstrual disorders, and due to that, moreover, infertility cases are increasing day by day. That is mostly happening due to sedentary lifestyle. Females are putting on weight, due to that they are developing PCOS, PCOD, irregular hormones. Also, they are taking too much stress. Nowadays, the stress is increasing day by day. Due to that, also, the hormones are getting imbalanced, and it is leading to vitiation of Artava Srotosa. Moreover, the causes that are mentioned over the screen are hot foods that will vitiate the Pitta dosha, improper lifestyle, excessive sexual activity. So, the symptoms of vitiation will lead to infertility, loss of menstrual flow, inability to tolerate sexual activity. This is also one of the symptoms. Also, one may experience irregular menstruation. Also, one may experience long menstrual cycle. Also, one may experience less bleeding in menstruation. So, let's discuss about the types of Srotodushti and vitiation of body channels carrying menstrual blood. If there will be excessive flow or atipravritti in these channels, then they will lead to menorrhagia, excessive menstrual bleeding, polymenorrhea, dysfunctional uterine bleeding. In this case, the bleeding will be more and more, and there will be no cause of this bleeding. It will not stop in normal days like 4 to 5 days. Then polymenorrhea. In case of polymenorrhea, what gonna happen? There will be more than one cycle within 1 month. So basically, in case of polymenorrhea, what gonna happen? The cycle will be very short, like less than 20 days. Then comes obstruction or sung. In case of obstruction, there will be amenorrhea, loss of menstruation, no menstruation, absence of menstruation. Oligomenorrhea, the cycle will take more than 35 days to come again. Then is Sira Granthi, or abnormal growth. Abnormal growth is very common nowadays. PCOS, PCOD, or ovarian cyst, uterine fibroids may develop. Then comes Vimargaman, or misrouted flow. So retrograde menstruation linked with endometriosis or ectopic pregnancy. So in case of endometriosis, what's gonna happen? The tissue of endometrial lining may develop in the ovaries, in the fallopian tubes, wheresoever rather than the uterus in the reproductive tract of females. So this is a condition called endometriosis, and whenever there is the menstrual flow occur, the flow also comes from those tissues that are developing in the ovaries, in the fallopian tubes, or in the pelvic line, anywhere. So on the other hand, what is ectopic pregnancy? So ectopic pregnancy means after conceiving, after fertilization, the fetus get placed in some other area in the reproductive system rather than uterus. That is ectopic pregnancy. So this is misrouted flow of channels carrying menstrual blood. Then comes do's and don'ts in such cases. So basically, one have to avoid the sedentary lifestyle, sedentary eating. Okay, they can take ghee, sesame oil, warm, easy digestible meals, use of milk, almond, dates, and figs. Then one can have antioxidant foods. That will be also really very good for this. In don'ts, one may have to avoid caffeine, one may have to avoid alcohol, spicy, oily, cold, and processed foods. Then comes lifestyle changes. So first of all, avoid excessive stress, because that is one of the most common cause nowadays for hormonal imbalance. Then is meditation and pranayam. Do breath control, do anulom vilom for balancing the hormones. Then comes Panchkarma therapies that will help. So Uttar Basti. Specialized enema through the vaginal route. This we have to give through the vaginal route. It will effective in infertility and also in endometriosis and also in all the gynecological disorders. You can give this. Then is nasya, or the nasal administration of medicated oils. Nasal administration of medicated oils will regulate the hormones. As I say, that hormonal imbalance is one of the common cause for vitiation of Artava Srotasa. So we need to regulate them. So one of the good Panchkarma therapy for that is Nasya, nasal administration of medicated oils, that will regulate the hormones via the HPA axis, hypothalamic pituitary axis. Then comes a very different concept of Manovaha Srotasa, channels of mind. As if in the starting I have mentioned that about these channels there is not much mentioned in our classical text, but these channels plays really very important role for our emotions. So their root is Hriday and its 10 great vessels. First of all, they originate from there. Their working will be managed from there. Then comes their cause of vitiations. Cause of vitiation basically related to the emotions, whether we are angry, whether we are beloved, whether we are in more fear, whether we are in more greed, in more panic, in more jealousy, in more anger, in more lust. So if there will be excessive of anything, then it will vitiate the Manovaha Srotasa. The symptoms will be related to, obviously will be related to the mental health. But that mental health further on will affect our body too. So these symptoms include mental instability, mental exhaustion, giddiness or delusion, okay? Bad emotions also, overthinking, and also very relaxed mind may be there. So in case of more kapha dosha, the person will have very calm and relaxed mind. So basically there are 3 gun that is related to the mind, that is sattva, rajas and tamas. Whenever there will be sattva in moderation, the person will be good with her mind. But whenever there will be more tam dosha is correlated with kapha. So kapha means the person will be more relaxed. It is the quality of control. Tama is the quality of control. If it will not be in moderation, it will lead to more relaxed mind, very relaxed mind, without any tension, without any worry. On the other hand, if there will be more raj, which means more activity, because raj is the quality of activity. So if there will be more activity, the person will get more angry. The person will be more hyperactive. So due to these guna, there is 3 guna, that is sattva, rajas and tamas. Whenever they will be in balance, they are known as 3 guna. Whenever 2 of them are dosha, that is raj and tam, because they are quality of control and quality of activity. So whenever they will get vitiated, the person may develop mental disorders. So they need to be in moderation, in normal amount. Then comes type of Srotadushti, vitiation of body channel related to the Manovaha Srotasa. So whenever there will be excessive flow, the person will be anxious, there will be mania, there will be panic attacks. Then comes Sangha or obstruction. Whenever there will be obstruction, the person may experience depression, drowsiness, mental confusions, brain fog, etc. Somebody is not understanding what's going on by their side. So this is going to happen whenever there will be obstruction of these channels. Whenever there will be abnormal growth, tumor may develop. So condition like neurofibromatosis may develop. These are kind of tumors. Then comes Vimargaman or misrouted flow. Hallucination will come. Whatever is not exactly around them, they will feel like those things are around them. Those things are happening. Multiple personality disorder. In this case, what happens? Somebody is behaving very good at once. Another time, they are feeling like more angry. They behave more angry. Sometimes they become anxious. Sometimes they become happy. Sometimes they become sad. So this comes under multiple personality disorder. This happens in misrouted flow of Manovaha Srotasa. What kind of dietary changes one can make? So basically mind is more related with the vata, because vata is one of the things that is related to the neurological conditions. So we need to give them calming diet. So warm milk, chamomile tea, fresh seasonal and light foods are advisable to such people whosoever is having vitiation of these channels. What kind of things they have to avoid? They have to avoid alcohol, say no to caffeine, spicy, sour, salty and bitter food items. So next are the lifestyle changes. So basically meditation, head massage you can give them. Also you can ask them to avoid night awakening because it will vitiate the vata dosha. Head massage with warm oils and early to bed. Sleep at time, sleep early. Otherwise, it will vitiate the vata dosha and further it will vitiate the Manovasrotasa. Shirodhara and Nasya, the Panchkarma therapies that are really very good to calm the vata dosha, the nervous system. So Shirodhara, pouring of oils on head, it will calm the nervous system. Then is Nasya, nasal administration of medicated oil. It will clear the blockages, it will clear the mental fog, it will enhance the memory too. And for all kind of mental disorders, Nasya is really very effective. Nasa hi shitsodwaram. You must have heard about this. So whatever is related with our head will be sorted by the Nasya, the nasal administration of medicated oils. So hopefully you have learned a lot from this lecture. If you have any queries, any doubts related to this session or lecture, you can ask in the comment box. So let's conclude the lecture. Acharya Charak has stated that a man is nothing conglomeration of Srotasa which pervades the entire body as are essential for both disease manifestation and maintaining body's basic physiological functions. So in the starting, as I have told you, that for Ayurveda student or practitioner, study of Srotasa is really very important, because with the vitiation of these Srotasa only, any kind of disease is happening inside our body. So if you will going to get these things clear in your mind, that what are the basic role of Srotasa, what kind of Srotasa are in our body, what gonna happen with their vitiation and how we can deal with them, how we can correct those vitiations, definitely your treatment protocol will work. So hopefully you like this lecture, and whatever doubts you are having in this lecture, you can ask in the comment box. So we will meet in the next lecture. So till then, take care, bye bye and thank you.
अब घर बैठे ऑनलाइन कंसल्टेशंस करें टॉप एमडी आयुर्वेदा स्पेशलिस्ट के साथ, इंडिया का बेस्ट ऑनलाइन आयुर्वेदिक क्लिनिक, और पाएं सारी आयुर्वेदिक मेडिसिन की होम डिलीवरी वर्ल्ड वाइड। प्रॉब्लम कोई भी हो, सोल्यूशन सिर्फ एक, www.planetayurveda.com।